All across the country, people are coming together to speed up what we can learn about health. The All of Us Research Program is calling on 1 million people to join us as we try to change the future of health. For your family, for future generations, for all of us. Visit joinallofus.org and find out how you can become one in a million.
Hello, everyone, and welcome to the All of Us Online Cafe. My name is Kelsey Mahaffey, and I'm the All of Us Project Director for 50 Forward, one of the national community engagement partners for the All of Us Research Program. We are located in Nashville, Tennessee, and we are here to provide education and outreach on the All of Us Research Program. With me today is one of our 50 Forward peer ambassadors, Mr. Royce Sisk, and he will be talking with us about why he joined the All of Us Research Program. So welcome, Royce.
Hello.
Yeah, thank you for being with us.
Thank you for having me. I look forward to participating in this.
Good, wonderful. Well, before we get started, we should probably share some facts about the All of Us Research Program in case this is one of your first time watching one of our videos. And what the program is really it's changing the future of research in healthcare. The program is a new initiative with the National Institutes of Health, and we are seeking to enroll 1 million people from diverse backgrounds living in the United States to volunteer and share their health information. And like I mentioned, this is a new initiative. It is a new way of doing research, and it's done through data collection. And so we'll be talking more about that and what makes the program different than traditional research studies. So let's get started. Royce, let's start out and let everybody know, has anybody joined this program yet? You know, we've been live for over 2 years now. Tell the people out there, how many people have enrolled so far?
Well, based upon the latest information, although it's a 10-year initiative, at this point in time, over 350,000 people have agreed to participate in the program in some capacity.
Yes.
Because you can participate as much or as little, share information in like your electronic health records, or provide a biospecimen. So we're really excited. It appears that we are going to change the way medicines are developed, healthcare is delivered, and make this information available to all those who make that happen.
Yes, so exciting. That is so great. Love to hear that we are a third of the way there, more than a third of the way for people that have created accounts and gone ahead to that website, joinallofus.org, and officially joined the program. So Royce, why don't you tell us a bit about yourself and your background and anything that you want to share about yourself, and then also what attracted you to the All of Us Research Program?
Well, I've kind of been a community engagement activist since I was age 5. I have clear recollection of helping my mother set up chairs at a United Way agency where she volunteered and later became the program director. Having 3 sisters, at age 5, I was a mascot when they went to Girl Scout camp, and being involved in voter registration drives, tagging along with my mother and brothers and sisters. It's always been part of my DNA to assist folks in navigating the resources and benefits that are available to them to improve the quality of their life. So my becoming involved with this program is a natural transition after a successful long career in corporate America and professional sales. Things work in full cycles. So I'm back to helping those who need to get a better grip on the quality of healthcare in their life, and being an African American male, be more engaged in helping folks to navigate and understand how healthcare works, how medicines are developed, how important clinical trials are, and of course to undo some of the stigmas and basically bad experience that some in the community of people of color have with the association in terms of clinical trials. So I feel that all of my life experience and skills has placed me in a position where that is what I'm supposed to be doing. You
Yeah.
know, I'm educating, informing, and helping folks to navigate this landscape so that can either, if not in their lifetime, but perhaps to help to change the way healthcare is delivered, medical procedures are done, and how to have more diversity in terms of clinical trials.
Right, right. That's fabulous. I love that. And I know the answer to this next question, just knowing you and knowing
Okay.
your background. But can you talk about how long you have been involved in research studies and other research studies that you have been a part of, and maybe how you got involved in even thinking that you wanted to be involved in research?
Having a background in marketing and back in the early days, while I was a college student, I kind of stumbled on uh, clinical research trial participation as a source of income, but also at the same time, I found that my contributions were helping to have an impact on how uh, medicines or procedures are developed. You know, I initially started out with eye studies, or remember having an athletic background. I participated in one that just wanted feedback from folks that experience what's called athlete's feet.
Yeah.
And here recently, I'm currently involved as a control in a pre-diabetic study. I'm not one that has diabetes at Vanderbilt, and I've been involved in several studies for dry eye, because people my age, it's a common ailment and such. So that information helps the way new medicines and treatments are developed. So
Right.
not only is it something where you're compensated for your time and travel, but you can have an impact in terms of shaping and being part of a team or an army of folks who are helping to shape how healthcare and medicines and procedures are developed.
Yeah, that's fantastic. So since you have such a rich background in research and you've been involved in previous studies, what is it, or some more than one, probably I'm sure that you would be able to say, that what is it that you think makes the All of Us research program different than a traditional research study?
Oh, that's a great question. I'm always excited to answer that question. Traditionally, research will show that most studies recruited folks from a particular socioeconomic or ethnic background, and it tended to be white males between, say, 20 and 50. Sometimes because there just wasn't any outreach to communities of color or people of different backgrounds. So, for example, with the challenges that we're dealing with COVID-19 right now, a large percentage of the very sick and the deaths are associated with people of color who are over 60
Right.
and who have pre-existing conditions. And in certain communities, there's a big distrust or lack of understanding of how the healthcare system works. So having the background and the involvement that I had, I felt that, hey, what better person than me to help educate, inform, and assist people in understanding the importance of having a diverse community participate in a program like All of Us.
Right.
I remember in my first year, I constantly asked you to refresh me on you are the underrepresented biomedical participants.
Yes.
And when I first read about it in the 50 Focus,
50 forward.
50 Forward,
Yeah,
I'm sorry,
50
50 Forward,
Focus.
the Focus
Yeah.
newsletter.
Yeah.
This is after I had worked its community outreach with the National Council on Aging, the Senior Community Service Employment Program, I was like, hey, everything I did there will translate here. You know, I've worked with seniors, I've done community outreach. Folks say that I'm pretty good at taking what might appear to the average person to be complicated information and making it understandable and relevant.
Yeah.
So as a result, I'm going into my third year as a peer ambassador with the All of Us Precision Medicine Research Program.
Yes,
Because that's the key. For example, when one goes to the eye doctor, he just doesn't examine you and reach on the shelf and hand a pair of glasses. The lenses or the contacts are custom designed based on whatever particular vision challenges that one may have. So that is the key to our program, to take the information and enhance the process and develop a new approach so that everyone being treated in the way medicine's developed and procedures will be precision, precise, and cater to that particular person or situation.
right, exactly. And that, I love that example that you give of the eyeglasses. I use that a lot.
I think I copied it from
Yeah,
you.
you may have, and that's fine. You know, you're sometimes we have these fancy medical terms like precision medicine that, you know, you're
Exactly.
not exactly sure what that means, and the easiest way to explain that is the eyeglasses. Those are tailored to you. That is something that is precisely made just for you. You know, if I had my glasses on, you and I, Royce, would not be able to switch eyeglasses and
Exactly.
see clearly. And so that's the best, easy to understand description of precision medicine. And we want to take that concept and put it out there for all diseases, all ailments, and be able to bring precision medicine to the forefront for all diseases.
Exactly.
Yeah, it's great. So, and you mentioned you've been a peer ambassador now into your third year. We've been so fortunate to have you on our team.
Thank you.
It's been great. You are awesome at what you do. But you've mentioned about the stigma that you sometimes hear people in the African American or Black community that they may have with research. And could you talk a bit about that and how you address that and what you say to those people that are very hesitant to participate in research?
Well, it kind of summarizes itself. It's kind of like voting. You know, if you don't vote, don't complain.
Yeah.
And or either you know, you can either stand for something or fall for anything. There's no situation, historical or experience or process that did not have challenges. Of course, it only takes one or a few misguided folks who are involved in the way things used to be in terms of clinical research. And it ties into other socioeconomic and cultural challenges, and in this new social awareness and cultural awareness and racial awareness environment, those things bring a certain sensitivity. But in looking at the entire picture, if a particular community is somehow or another more aggressively impacted by something like a pandemic that we are experiencing, but the data that from clinical trials and prior research does not reflect the uniqueness or the particular scientific or how would you say genealogical or DNA challenges of that particular community, then when a vaccine or a treatment is developed, it may not work.
Right.
I can't recall, but I remember we have gone to events together, and there's a particular heart medicine, which you probably can refresh us
Yes.
on, that is not effective at all on people of sub-Saharan ancestry, Mediterranean, Caribbean, because a lot of that all stems from the melanin or the genetic makeup of those people. But
Right.
the industry still prescribes it,
Right.
and
It works best for most people.
it works best
so
for
try
most people.
this.
But
Yeah.
if when it were developed, it's just like when medicines are developed for adults, and say after a few years, because a patent pretty much only gets has exclusivity for 7 years, a less powerful dose might be okayed by the regulatory agencies for children. But in most cases, children under a certain age can't participate in clinical trials. And then there is a challenge in terms of folks believing that just because it was on TV or if it was on the internet, and or either it gets associated with a conspiracy theory too, like, oh, it's designed to eliminate a particular portion of the population. Yeah, there are those who are going to subscribe to that, but I take it as a challenge to demystify and to correct these misconceptions that certain people within the community of color have about things such as the Tuskegee experiment,
Right.
the proliferation of vaccines only in African American urban areas in the 50s and 60s and such. So
Right.
it's like Dr. Hildreth at Meharry has spoken out about that, being that he's part of the task force here in Metro, and it's something that the more facts that folks have, the less likely they are to fall for the craziness,
Right.
so to speak.
Right.
So part of my responsibility is to be a myth buster,
Yes.
a precision medicine myth buster.
Yes.
Okay.
I like that. Yeah. That's a good title there. Yeah, and I love that you addressed that, and I think too the program is one thing that makes it different is it really looks at the people that are enrolling as partners. It is not something where the program is just going to study you and you will never hear from them again. It really is a partnership, and to me it feels that way. I've actually joined the program myself, and I know you can speak to that since you have joined and been a part of other studies. But they really want to create that level of trust. Whatever information that you do give to the program, that is always returned to you. You will get your DNA results returned to you. You will get other information, other health related information that you might discover that will be returned to you. So that's something I think is different too, talking about just having the information available that can help demystify some of that also.
Exactly.
Yeah, great. So I wanted to ask you too, since you're out there and talking to folks and telling them about the All of Us research program, what is something that you wish people would understand better when you're speaking to people? What do you wish that they would understand more about the program?
I think there are some that have a misconception when they hear research, clinical, and things mixed together. They automatically create a force field, so to speak. And in some cases, there's good reason. For example, we participated with the Nashville Public Library by partnering with them to show at multiple library locations the incredible life of Henrietta Lacks,
Right.
which set in the time period that it was and such, and how everything that was involved there has impacted modern medical research. And the other challenge is that folks feel anytime anyone or any organization, because I think everyone in the world right now knows who the National Institute of Health is.
Yes.
However, 2.5 years ago, when I became involved with the public, some folks didn't really know. So they understand that this is a not-for-profit pharmaceutical or medical device company, and so they're like, the, they get government funding. They, they want my information. This is another way to, violate my privacy. So, but I wish that more folks would understand that it's like exercise. No no pain, no gain.
Right.
You could be an Olympic status fitness level person, and then if you stop for 3 months and dig yourself in on the sofa with the remote glued to your hand, you're no longer going to look and have the energy level and all that as that point in time when you were a Olympic grade athlete. So,
Right.
but there are those who, of course, when something goes wrong, and something always goes wrong because it's like a 360 degrees. We all get a little sick from something at some point in time.
Yeah.
Whether it's physical, whether it's emotional, whether it's mental, sociological, or whatever. And of course, when folks are faced with a challenge in terms of their health, they want the best possible results,
Right.
but they don't want to pay into the system just by sharing their electronic health records, becoming more knowledgeable about clinical trials, having a more diverse mix of individuals so that the medicines and procedures that are developed can benefit more of the community, because just like in this new normal that we're in,
Right.
there are loads of people who are going around just fine, but they are asymptomatic. They do not have the symptoms, but and I don't know if I have the numbers accurate, but I remember this one lady I read recently on Yahoo News who regularly went into a Starbucks once they opened back up and had a limited number of people, and the contract tracers were able to find out that she somehow impacted and exposed over 54 people.
Oh, wow. Yeah.
Some at varying various levels.
Yeah.
So, but I think the biggest challenge is folks when they understand that their information will not be sold, that they have complete control over it, and that the importance of sharing this, and that they'll get their DNA information back, and
Right.
that
And their information is de-identified.
is de-identified.
Yeah,
Yeah,
so there's no
it's
personal
depersonalized,
information.
and it's aggregated with others. For example, kind of like contact tracing, where because of contact tracing can identify, because there was a big news story here in Nashville yesterday indicating a number of over 40 different hotspot locations based upon the number of cases. So our program can kind of work like that too. So it can identify, say, a particular geographic area of a city where people are experiencing certain ailments.
Right. Yeah, that's a great way to explain that.
Yeah, but every day in life and in every circumstance, your information is out there.
Yes. Yeah.
Whether
Swipe the card at the pump.
whether you want
Yep.
it whether you want it to or not. So
Yep.
you may as well make it for something that can have a positive effect, and if not in your lifetime, maybe in the future.
Right.
Because with some of our partners, some folks who are providing biosamples are being sort of cryogenically frozen.
There you
Kind
go.
of like a
Big
sci-fi
word.
movie.
Yeah.
Which means 20, 25 years from now, your sample may be like the hit movie on Netflix.
Yes. Yeah, you never
sci-fi
know.
hit on Netflix.
It's exciting to think about what discoveries are still yet to be made. With the diseases that they're going to be able to study everything. Cancer and Alzheimer's, anything. So the researchers will be able to use this rich resource of information to hopefully find better treatments for us, for all of us, for the future. So that's great. And on the other flip side of that question, what do you think is the message that resonates the most with people? What is it that speaks to them, those that you are talking with that really get this and can grasp on? What is it that they see and that is making them want to participate and enroll in the All of Us research program?
Without sounding cliche, I think the big thing that helps people understand how practical, different, and unique this program is that it's not, without, when I said the cliche, it's not big pharma behind it. Yes, we have partners in the industry, but when I first researched it, a little bulb went off in my head. I was like, gee whiz, you hear about studies all the time, such and such organization studied 1,022 people with a plus or minus, error rate. I was like, okay, how many people in America?
Yeah.
How many people in the world? That's a small study. And then
Right.
you hear this, the study of the study of the study show.
Yeah.
But then I looked, I was like, this is so practical. Why hasn't this been done before? If you're gonna go, you may as well go big.
Right.
Go big or go home.
Yeah.
And for the goal of having 1 million participants, and we are a third of the way along in less than 3 years,
Yeah.
because this is going to be a massive study. This is generational information and data that can impact the quality of life and change the way healthcare is delivered, medicines are developed, and medical procedures are done. It was almost like a eureka moment. I thought to myself, gee, if you're going to be doing studies, make it impactful and
Right.
do it right and make it open source, so to speak. Where it's not going to be proprietary, where a big cartel of pharmaceutical and medical supply companies control this. Kind of like in the Constitution, it's we the people.
Right.
It's not the corporate donations or whatever.
Yeah.
It's the we the people. This information belongs to the people who participated and who voluntarily. They weren't forced to do it.
Right.
And there was no hidden agenda involved in it, because a participant can just give their electronic health records if that's all they want to do. If they want to,
Right.
they can give a biosample. They don't have to. They have the option of getting their DNA results, which, like the great letter that was sent out the other day, a lot of folks don't understand. Sometimes just having a snapshot of your DNA profile, you may wonder why you're having digestive issues, but your DNA may show that you shouldn't drink more than a cup of coffee a day, because
Right.
genetically you're predisposed to not be able to process it efficiently, or it can cause other irritation, or the fact that people can take an early preventive approach because there may be a family history of a particular disorder or a type of disease.
Right.
So you definitely want to deal with something before it becomes stage 1, and definitely before stage 4, when it's kind of like a vehicle. Some people only put gas in their car and never wash it, never
Yeah.
get the oil, and then they're frustrated when something isn't acting right. So
Right.
it's
Yes.
the same type of thing.
Yes. Yeah, that's great. Well, I think our time is just about up for today. So I want to thank you again, Royce, for sharing your wisdom and insights with us and your experiences in research and with the All of Us research program. Thank you for being a peer ambassador for 50 Forward and all the great work that you've done for us so far. And we just want to remind you all out there, now more than ever, people are understanding the need of research.
That's
and
right.
why this is important, and why the diversity is important. This is a chance for your community to be included, You want to be a part of the cure, so you want to be included. You want to make sure that the diversity is represented in this data set. And we encourage all of you, Royce and I both do, to visit the website and learn more information. That website is joinallofus.org/50forward. You can also find a link to that website on the 50 Forward website, which is 50forward.org. And of course, here on Facebook, we have our information with the All of Us Research Program 50 Forward page. And once again, thank you for watching this latest installment of the All of Us Online Cafe. Royce, it's been a pleasure.
Thank you.
Okay.
Always.
Always, that is right. And thank you so much for watching, and we'll see you next time.